Oh, at the stage.
We did it
You hear me?
perfectly.
Okay,
We are
perfect. So
live.
we're live, we're going to jump right in. Hello, everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. For those who don't know me, I'm Dr. Aminola Dada, and I have a fantastic guest today, and we are going to be talking about some interesting stuff. So if you're having dinner, put it away. Okay, we have the phenomenal Dr. Vivian Asamoah, and she is a phenomenal gastroenterologist. I'm going to let her introduce herself. She's a functional medicine doc. She is brilliant. She is smart. She solves all poop related problems. And this is going to be an interesting talk. So, Dr. Samoa, please introduce yourself.
Hello, Dr. Dada. Thank you for having me on your Facebook Live with Overlake Osteoarthritis. Am I saying it right?
Overlake Arthritis and Osteoporosis Center.
Overlake Arthritis and Osteoporosis Center, Center of Excellence in Seattle. I'm so honored to be on your show today. We are streaming live, and I am all the way in Houston. Actually in Katy, which is West Houston. I run an integrative gastroenterology practice here in Houston, been in practice for over a decade. And our practice is a little bit different. We actually practice a different kind of gastroenterology care where we merge the best of both worlds, conventional medicine and integrative functional medicine. And I'm excited to talk about poop. Are you excited to talk about your poop?
I,
Dr.
I
Dana, your
definitely am, and I have questions because I'm bringing it. So I'm
Okay.
in Seattle. You're gonna have this is cross cut. This is all over the country, right? This is me in Seattle, Dr.
Yeah.
Asamoah in Texas,
Texas all the way.
all the way across the country. So we have some interesting questions. I've been thinking about it. And I was like, you know what? I got some questions for Dr. Asamoah. So first and foremost, Dr. Asamoah, tell us what makes your practice different? I think you hinted at it a little bit. Why come to you versus the garden variety gastroenterologist?
Well, so I believe that a lot of gastroenterology is really revolves around what's going on, what you're putting inside your body, right? Because when you have gut issues, very often it can be affected, directly affected, or made worse by what you're eating. And so our practice is very different in that way. I'm Johns Hopkins trained, fellowship trained, board certified, and had a great training in terms of everything that's conventional gastroenterology. We do procedures like screening colonoscopies, diagnostic colonoscopies, endoscopies, dilatations. We work up liver disease, pancreatic disease, gallbladder issues. Basically, we do anything from mouth to anus for the most part, right? But what we do a little bit differently at our practice is we really bring in that nutrition component using food as medicine and making sure that not only are we diagnosing and maybe prescribing medication, but we are looking at the patient as a whole. We talk a lot about the gut brain connection and how much the gut can affect stress. Stress can affect the gut, cause anxiety and depression. So, being a GI, we're kind of a little bit like shrinks. We're a little bit like psychotherapists as well, because very often our patients will tell us that when I'm stressed, my gut hurts. And it makes sense. And they also tell us when I eat the wrong foods, my gut health hurts. And so it's really important for us to look at the whole patient, the overall well-being of the patient, what they're eating, how they're taking care of their body, if they're exercising, if they're taking medications that could be causing symptoms. And I think that's how we're different. We kind of look at the whole picture, the whole you as a patient.
Yeah. I was just thinking as we were talking, so in my world, like fibromyalgia is an issue, right? And a
Yes.
lot of patients have irritable bowel syndrome, right? And that's just a basket for where, once we don't find the usual suspect, is not Crohn's, is not colitis, we're like, okay, it's IBS, and we're not really sure what to do for you, right? So it
Yes.
sounds like you have a different approach to that.
Absolutely. And I think there is a different approach. So my IBS is your fibromyalgia. And guess what? They are connected, right? And so because they are connected, we have found similarities in the microbiome of patients with IBS and the microbiome of patients with fibromyalgia. So there is definitely something going on, not in the brain. Like, we always, oh, our IBS patients are kind of just really irritating type A personalities. It's not true. There is actually something causing that, possibly causing that anxiety. And I think there's so much data coming out right now in the last 10 years. There's so much data compared to when I started training 10 years ago
Yeah.
about how the microbiome causes intestinal hyperpermeability and how that may then affect other organs, right? One of them being the joints, right? Or muscle, how that can affect other things. So I think we are going to learn more about how these entities are directly connected and how we can better help our patients. And it really is looking at all the data, it's using a more holistic approach.
Okay. So talking about holistic approach, right? Even when you have patients with IBS, because sometimes once in a while one wonders, is this kind of a normal rate of pooping? What is what should be the normal frequency? I guess it depends on what you eat, but I'm sure you have more to say on this issue.
So you are asking,
Yes.
what is the normal frequency? What is normal poop in terms of
What is
frequency?
normal? Yes. Yes.
That's a wonderful question, and it depends on so many things. But for the most part, I want to start off by saying that pooping is essential.
Mm-hmm.
It is the way our body, that's the last stage in the detoxification and elimination process. It is the way our body eliminates.
Yeah.
And if you live and breathe and eat and are exposed to many things every day,
Yeah.
then shouldn't you eliminate daily, right?
Yeah.
If you eat
Definitely.
3 times a day, why should that stay in your system for 3 to 4 days?
Mm-mm.
A bowel movement a day is wonderful. A bowel movement 2 to 3 times a day, totally acceptable. Dr.
Mm-mm.
Dada, remember children, when
Yeah.
babies, when they're born, they eat, they poop.
Yeah.
And children for the longest time continue that way. They eat a meal, they're like, oh, let me go empty out. And then they come back and fill their bellies. That's ideal as long as the stool is formed and
Yeah.
we feel we have complete evacuation. There
Yeah.
are some people, especially men, who will say, I go 2, 3 times a day. It's formed. I feel comfortable. I'm good. So 1 to 3 times a day, so long as the consistency is formed,
Yeah.
perfectly healthy. Great way to eliminate. Yeah.
Excellent.
Mm.
Wow. Okay. So since we're diving into the matter, what about color? Because sometimes you look back and you're like, is this a normal color? I've seen all kinds of colors though.
Yeah, no, patients always talk about color. And the color can also, some patients will describe, it's really dark. And there it's important to talk about color and consistency.
Yeah.
We're talking like poop experts, right? That's why Dr. Dada said, put your meal away because, but whenever you guys go see your gastroenterologist, please feel free. Don't be shy about talking about your poop because this is what we do. We love to hear about it because it helps us understand what is actually going on inside the gut. So we ask a lot of questions about poop. We started off with frequency. Now we're talking about color. So some people will describe, let's talk about the shades of brown,
Yeah.
right?
Yeah.
So brown stool, perfectly normal, right? Just
Yeah.
brown. Some people will say it's a little bit darker. It's dark.
Mhm.
I feel like it's kind of black, Dr. V. And I'll say, well, is it black and hard? Are they small
Mhm.
pebbles? Because when
Mm.
your stool doesn't have enough water in it, it will look dark, very, very, very dark, what we call dark pebble. And we actually even have a little score system called the Bristol stool chart that
Yeah.
we show our patients, and it goes from stage 1 to grade 1 to grade 7, 1 being small little pebbles, dark
Mhm.
stool, grade 2 being, kind of rockish, grade 3 being still dark, and grade 4 is like a smooth bowel movement. So
Okay.
if you're more constipated and you're
Mhm.
straining to get those little rocks out, your stool is going to look darker, right? Like a darker brown, right? But we are concerned when patients tell us their stool looks black.
Mm.
My phone, like it's black.
Yeah.
And their consistency is important as well because we'll ask, is it black and tarry?
Mm. Yeah. Tarry black.
Tarry
Mm.
black and does it have a very pungent smell? That
Mm,
is usually a sign of digested blood coming from the top, the upper
mhm,
GI tract. And when
yeah,
we talk about digested blood, we're thinking, are you bleeding somewhere, right?
yeah.
And then there's the black of supplements.
Mm,
Pepto-Bismol gives you a grayish, dark stool
yeah,
appearance, right? So think about what you may have taken the day before. So if you took Pepto, a lot of people call us, "Oh, my stool had black hair." I'm like, "Well, did you take Pepto?" They're like, "Yes, I did." And so they're reassured. And then iron supplements will also turn your stools kind of a grayish color. So those are some of the shades of black we see. But the one I want you guys to think about is the black and tarry and pungent smell. You got to
yeah.
tell your GI doctor about that.
Yeah, yeah.
Mm.
But I'm giving my patients anti-inflammatory medications, right? So
Yeah,
we are probably in our world, we dread the day the gastroenterologist calls you because your patient had an ulcer from the drug that you gave them,
yeah,
right? So kind of black tarry stools is one of the things that I'm like, if that's happening, we need to know about it ASAP because some of the medications we may be giving you may result in a stomach ulcer that by the time it gets into the poop land, then it becomes pretty black, just like Dr.
absolutely.
Samoah is saying. So thank
Yes.
you for reminding us about that. So, but what about when it's frank red though?
Frank red, yeah, yeah. No, so frank red is also concerning, and even there are shades. So you know what? I don't mind, and this to Dr. Dada's patients. Take a picture and come and show Dr. Dada your poop. If you're
I
really
can't
concerned,
wait.
take a picture. My patients always come. They're like, "Hold on, Dr. V. Let me show you. Hang on. This is my sister's wedding. Here it is. Here is my proof." So yes, I
Please,
love to see
please
because
do,
it's different
please
when
do
we
send it.
describe it now, but now in the advent of phones,
Yeah,
take a picture. A
yeah,
picture tells a million words, 1,000 words, as they
it
say.
does, it
And so
does.
we can look at the picture and say, oh, is this red? If it's bright red, then we
Yeah,
think that it's bleeding coming from the lower part. So
yeah,
it could be hemorrhoids, it could be a cut at that anal area called a fissure, or
yeah,
it could be a polyp that's bleeding. Now, bright red is something that should also draw your attention, right? If you normally don't have any bleeding issues and you have regular bowel movements and there's blood in the stool,
yeah,
alert. Don't assume it's a hemorrhoid,
yeah,
especially when you're over 35 to
yeah,
40. It's important to consult. You may need a colonoscopy
yeah,
because it could be a polyp or even a mass that is bleeding.
yeah,
All right. So
yeah.
bright red blood is important. And I always ask my patients, the next question I ask is it mixed in the stool, like
Mm,
brown and blood, or do you see it before a BM or right after a BM or when you wipe? So when it's before or after, again, that makes us think of hemorrhoids or
mhm.
fissure. But when it's actually mixed in the BM,
Yeah,
we're
right.
thinking there's inflammation in the colon, like ulcers, colitis, right?
Yeah,
And that also warrants a colonoscopy. So bright red generally warrants a
yeah,
colonoscopy. Yeah,
yeah, yeah. Please definitely take a picture, send it to your friendly rheumatologist, and your
absolutely.
friendly rheumatologist will be sending it to Dr. Samoa. Mhm, yeah. Well, good. Okay, so we talked about color. What about clay, right? People talk about clay stools. Tell me, what does that mean? I'm
So
not sure what to think of it.
clay stools think I always think of first I ask what did they eat,
Yeah.
right?
Mm-hmm.
Sometimes some people are just chowing down on cashew nuts, a lot of cashew nuts. You can get clay color stools, but something I want us to think about is any problem related to the gallbladder, right?
Mm,
So if
yeah.
there's a gallbladder obstruction in the bile duct,
Mm-hmm.
patients will say, you know what, I'm having right-sided pain. I'm feeling uncomfortable. My stools are weird. They kind of look like a clay color, and my urine looks like a tea color. That's a
Yeah.
clue that there could be a stone that's obstructing the bile duct or
Yeah.
flow in the liver bile ducts is off. So clay color is also important. Take a picture, show it to
Yeah.
your doc. Yeah.
I can't wait. So with that clay color, what I do remember about is what about when your stool is floating? You
Yes,
flush, 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 it doesn't go away.
you see how exciting poop is? it's there's just so much about poop that we could just talk for hours, right? And that's why I encourage patients when they come to practice and they're kind of shy. They're like, oh, do you really want to? I said, I want to know everything, because it's through talking to our patients, and I'm sure you'll agree, Dr. Dada, that we often make a diagnosis. It's
Yeah,
not just through test, but you get as
yeah,
much information as you
yes,
can. So
yes,
when they say my stools are floating, they smell bad, and I got
yeah,
to flush like 4 or 5 times. If not,
yeah,
it just coats the
yeah,
lining, the base of the stool.
yes,
Then that could be malabsorption. That
yeah,
could be a pancreatic problem that we call in
mhm,
fancy GI terms steatorrhea. It just
mhm,
means there's fat maldigestion, and
yeah,
fat is coming out. You almost even see like an oily emulsion, like a layer of oil that doesn't mix with water
yeah.
in the stool. That's a sign that the pancreas isn't working. Another, that's an Instagram moment. Take a picture,
Yeah.
send it to your doc. Send it to
I
Dr.
love it.
Dada.
Wow. Okay. So I think we've learned about some important things about stool, what it looks like, what it should feel like, what normal is, how frequently it should be. So, Dr. Samuel, tell us about, an interesting patient or a patient that had kind of a good outcome, kind of working with you. Give us an example, because sometimes we kind of need to find ourselves in those people.
Just any
Go
case.
for go for it.
So, well, I'm going to pick a really simple case because sometimes simple is meaningful and people can
Yes.
often relate to that.
Yeah.
So, I had a guy who was about 50, 60, and he came to see me because his wife totally forced him to come. She was like, I'm so sick of your diarrhea. You're constantly in the bathroom. Like everywhere we go, you're like in restroom, restroom, restroom. And she's lived with this guy for 20 years and he just poops like 6 times a day. 6 times every. So that's way more than we said, right? That's too
Yeah,
much.
you said
And
three.
it's always loose. And his wife is like, it's so gassy, Dr. V. It smells like it's horrible. And he said, I have been to every doctor. I have seen GI. I have had like 3 colonoscopies. They can't tell me what's wrong. They told me to stop eating, dairy. I stopped. I stopped gluten. It didn't make a difference. And here I want to highlight, it is
Yeah,
important to do the food challenges, but when food doesn't change anything, you got to keep digging, right? There's something
yeah,
going on. He treated himself for parasites. They gave him antibiotics. It didn't work. And he was like, well, you're my like fifth gastroenterologist. And I was
mm,
like, really? Oh my gosh, I'm not going to figure this out. So I was like, well, let's just do a stool test. Let's just check,
mhm,
and let's check for something called pancreatic elastase. And
mm,
pancreatic elastase is a digestive enzyme, a byproduct that comes in stool. And if it's low, it means that our patient is not making enough digestive enzymes
mm.
and needs digestive enzyme support, which is just a supplement.
Wow.
Lo and behold, after 30 years of having
Wow.
diarrhea, his
Wow.
pancreatic elastase number, which should normally be greater than 200,
Wow.
was at 19.
Wow.
And I said, well, I was very excited when I found it. And I was like, has anyone else checked? He was like, I've given my stool several times, but I don't know if anyone's checked. I said, well, I'm super excited. Let's go ahead and start the digestive enzymes. So we started him on prescription dose digestive enzyme,
Wow.
came for follow up 6 weeks later with his wife, and he was a different man. He said,
Wow.
"My life has changed. This has made such a huge difference. I
Wow.
poop twice a day now. It's formed. I feel more energetic. I'm not
Yes.
losing
Yes.
weight," because he was struggling with a bit of weight loss.
Right.
And his
Wow.
wife was like the foul odor, everything. And all he had was an entity called exocrine pancreatic insufficiency, which we see in about 20-30% of patients. And it's
Wow.
when we say idiopathic in medicine, it's like we really don't know.
Most not enough to know.
We've checked for all these other things and we don't
Yeah.
find anything.
Yeah.
But with him, the solution was as simple as giving him these strong prescription digestive enzymes that he takes with every meal. So it just, and he told me, I'll see you in a year, Dr. V. I'm doing absolutely
Wow.
fabulous. He left an
Wow.
amazing review. I felt like, but I was like, yo,
You did what? You know what? You found, you know what? A lot of people had seen that patient and didn't come up with it. So, you know what? Kudos. And that's when I said the brilliant Dr. Asamoah, I wasn't kidding.
it
I
was
wasn't kidding.
it was a simple thing, but this is what I want to share with Dr. Dada's patients. Keep digging. She is also a she's a brilliant physician. You have an amazing rheumatologist. She will find whatever is going on, and so keep digging. If she can't find it, she'll find the right people. You want that physician who's going to listen, who's going to take the time, who's going to care, and that's what you have in Dr. Dada. So you guys are lucky. Keep digging. You'll find physicians who will care for
You're,
you.
you're too kind, Dr. Summer. So, can you give, at Healthy Joints Healthy Lifestyle, we like to give people 3 wins. So
Okay.
can you give our viewers just 3 easy tips that they can implement to kind of improve their gut health?
Absolutely. 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 So I will start off with the number one that we all struggle with, including myself. Let's go for a simple one. Stay away from soda. Okay. For 2 reasons. Whether it's soda that is diet free or regular, the diet free sodas contain all this aspartame and artificial sweeteners, which today the WHO has classified as carcinogenic. You'll look at the recent guidelines from the World Health Organization. These agents are carcinogenic. They do not help us, they do not even help insulin metabolism. So stay away from soda, diet soda, regular soda, because they all contain something called high fructose corn syrup. And high fructose corn syrup is the number one leading cause of fatty liver.
Yeah,
And fatty liver causes end stage liver disease called cirrhosis, which will soon be the number one leading cause of liver transplant if it isn't already.
wow.
So, number one tip: sugar, fake sugars, high fructose corn syrup, not your friend. Minimize sugar. So, a tip I always give to my patients, one pearl you guys can take is read labels, and if
Mhm.
it has more than double digits of sugar, anything more than 10, so 9 and up, probably not good for you. That's probably a cheat day. Okay.
Yeah, that's great. Yeah, that's good to see.
Just don't go beyond those double digits, 9 or less. Second tip: to maintain healthy gut health,
Yeah,
eat lots of fresh fruits and vegetables.
yeah,
So we're not saying, I'm a meat lover myself, so I don't think I can ever quit my goats, my oxtail, my chicken. No, but try
don't
to
make your mouth water, but yeah, okay.
try to incorporate a serving of fruit and vegetable, and do it mindfully at every meal. That's
Yeah,
what they're recommending now. A
yeah,
serving of fruit and vegetable will give you the necessary 25 to 30 grams of fiber that we need daily. Without fiber, we don't have a good microbiome, we can't poop. Fiber even helps prevent, restore or reverse diabetes. I mean, fiber is so beneficial in so many ways, and we just don't eat enough of it. So
yeah,
try and mindfully incorporate fruit or vegetables. So for breakfast, for example, I'll give you what I do with my kids at home and myself. They get a fruit, half a fruit. It could be a blueberries, banana, whatever. And
yeah,
then if I'm giving them turkey or chicken or eggs, there's some spinach, there's some mushroom, there's some beans, just a little bit, and or broccoli. And now they're used to that. So just doing that. And then the third thing I would say is, in terms of healthy gut, I think the third thing that we often forget is the impact of stress on our gut. And
yeah,
it's hard to say, don't get stressed. I mean,
yeah.
sure, I'm stressed today, right now, as we're doing this. I'm stressed, but
You
find
do.
find ways to cope with your
Yeah,
stress.
yeah,
And for you to cope with your stress, you got to sleep well, you got to laugh, you got to exercise.
yeah.
See, that's how I cope with my stress. So on my way home today, I will be blasting Dave Chappelle in my car. I will be laughing all the way home, and that's a way to relieve
The
all the
stress
stress
from the whole day, from the week.
from the week. You know.
Okay.
So yeah, just
So
those
three,
are the best tips.
yeah. So three very important tips. I'm going to summarize. One, high fructose corn syrup is bad for you. It's bad for you, causes liver issues, and it can also cause gout, by the way. Two, fill your plate with fiber, okay? And three, find ways to avoid stress, minimize stress and distress, even if it means listening to Dave Chappelle on your way home. Wow. So thank you so much, Dr. Asamoah. We are going to let you go. But before we do, can you tell us if someone is in the Texas, Katy area, how do they find you? Because there is so much you have to offer our patients. And you have the functional medicine going on too, in addition to, the natural gut relief program, which we didn't even get the opportunity to get into. There is so much that Dr. Asamoah has to offer in terms of really helping us get even our immune system on track using the gut.
Yes.
So how do people find you?
Oh, Dr. Dada, I will be happy to work with any of your patients, or if they want to refer people they know in Texas, you can find me on all the social media platforms, Instagram, Facebook. I'm now on TikTok, apparently. I'm somewhere there. I will have to go find myself. But I think the place where your patients and your audience may find and enjoy a wealth of information is on our private Facebook group called Natural Gut Relief. And that's where we share a lot of tips about natural ways to improve your gut health. Just using natural supplements, natural wellness tips, things you can do in terms of diets and recipes. We interview guests just like Dr. Dada does once a week on the Facebook group, and there's a wealth of information and lots of videos done. So join us on Natural Gut Relief. My practice website is drvivianasamoah.com. So you can find me there as well.
Okay. Wow. So this has been amazing. I've learned so much about my poop. I've learned so much about, when you need to see your doctor, right? When things are going well and things are not, what's normal frequency, good behaviors to adopt. So for those, again, we are kind of physicians really just working to help patients just be a healthy version of themselves. So at the Healthy Joints Healthy Lifestyle Show, you will find lots of videos where we just give you hints and tips on how to do better and live well. So my name is Dr. Aminola Dada. If you are in the greater Seattle area, find me at overlakearthritis.com. If you like this video, thumbs up, share it if you wouldn't mind, and subscribe to our YouTube channel at Healthy Joints Healthy Life with Dr. Dada. Thank you, everybody. Have a great Friday. Thanks, Dr. Asamoah.
Thank you.